Okay, so we can start. So today's class will be looking at body fluid compartments, and this is under cellular physiology. Okay, so for those of us that missed the class, there's a transcribed document that will be sent to the community, and people will be able to see how the class went, because the recording stopped somehow and we couldn't keep track of it. Okay, we couldn't keep track of it. Okay, Beauty has joined. That's good. Someone is asking, Samuel is asking, which one should be studied first between anatomy or physiology in terms of the topics which are found in both courses? Oh, so you find that us will be, you find that us we're going to do the physiology even before those guys they do the anatomy. Like for example, when you start the GI system, it will be, you'll find that for us, would have already done the GI, and then the paper boil about anatomy. So for us, if you are going to be studying, obviously it will be physiology first. But if you are going in an exam, because now you know in your brain there is data for both courses, what should be studied first is anatomy, then physiology, because you can't study this the mechanism without knowing the structure. Okay, so but us will be very quick, because you can even ask the people who are learning bio 1400 last year with us, they'll tell you that we're actually very fast. So you see that us we're going to be ahead of the anatomy people. Okay, hope I've answered that question. So we give, someone was asking about the price. It could be 100 kwacha or anything. But just know that the price will be given to you, bundles, money, so that at least you can help yourself. You can help yourself, guys. So before the recording started, talking about the human body having 70% of water. So the body is actually composed of 70% of water, and this water is distributed in various compartments, guys. So you find that some of this water is inside the cells, some of this water is outside the cells, some of this water is in the blood, okay, because the blood vessels. So some of this water is in the blood vessels, some of this water is in the space between the lungs and the chest cavity. Some of this water is between the heart and the chest cavity. Some of this water is in the brain, in the central nervous system. Some of this water is in the joints, okay? So we want to know where this water is, because in case you are dehydrated, there's dehydration, a case where you don't have enough water. What is going to happen? What is the physiology behind dehydration? Okay, so physiology is about the normal thing. Okay, next academic year you learn about pathophysiology of diseases. That would be your pathology. Here we are talking about normal things, unless we're talking about the applied aspect of physiology. So guys, my question, most of these questions are applied. Let me be honest with you. Most of these questions in PGY, they are applied, okay, to my basics into ngono she. Like for example, explain about outline the mechanism of skeletal muscle contraction. That one is basic, okay. Most of the questions that will be given to you will be applied, and that's why people are actually complaining and they were failing. The same goes to biochem. So they'll be applied questions. You have to be very much careful. So this water which is distributed is very important, because this is where biochemical reactions happen. So if we don't know about the distribution of the body water, it will be very, very hard for us to understand diseases like diarrhea, because diarrhea affects the body fluid compartment. There's a lot going on when someone has diarrhea. Okay, you may be laughing at them, but there is a lot going on when someone has diarrhea. So the body fluid compartment is very important to understand. very important to understand how you are going to measure the volume of the various compartments. Okay, how do you know that the extracellular fluid is, for example, 40%? How do you know? Okay, and the intracellular fluid is 60%, or the other way around. How do you know that the intracellular fluid compartment is 40% and the extracellular fluid compartment is 60? How do you know? Okay. And how do you measure these volumes? Because we have methods that we use. How are we going to be able to measure the osmolarity? Okay, because you need to know about osmolarity in case someone has diarrhea. You need to be calculating and know what is going to happen to the body fluid compartments, because there will be changes that will take place at that particular point in time. Okay, so by the end of this class, students will be able to tell us the various body fluid compartments and how we measure these compartments, the volumes. You should be able to tell us, okay, the effect of dehydration on the body fluid compartments. Okay, what happens when you take a lot of salt by mouth? What is going to happen to the body fluid compartment? The changes that are happening. So you should be able to tell us all those things. So guys, any question before we move on? Okay, so by the end of this class, students should be able to explain the following concepts. You must be able to discuss the distribution of the total body water, okay, which is denoted as TWB in the body. You should be able to list the ionic composition of different body compartments. And then last but not the least, you should be able to explain the principles of measurements. How are you going to measure the body fluid compartments, the volume of the body fluid compartments? Okay, so those are the things that we're going to learn tonight. And by the end of this class, we should be able to tell people at home, because this is medicine now. This is not NS, this is medicine. Should be able to tell people, apply this knowledge. Okay, in case someone has diarrhea, should be able to tell them what to do by the end of this class. Okay. Okay, so when starting, I mentioned about the systems of the body. So the body, we can look at it as an open system, okay? And it will actually be exchanging the materials like food and also energy with its surroundings, okay? So you can see there that the nutrients and also salts and water, they are entering through the digestive system, and unabsorbed matter is coming out as fecal matter. And you can see the exchange that is happening between the digestive system and the cardiovascular system. So those nutrients, the salt and the water, they are actually going to enter the cardiovascular system. And the cardiovascular system is going to distribute these nutrients, salts, and water
and the nutrients are going to enter
I'm the only one that I can't get what you're saying.
digestive system. Then they are going to be unabsorbed. That's fecal matter. So there'll be exchange between the digestive system and the cardiovascular system. Oh, we are waiting for the dog.
Unaipenda mano mwaishe na umfokati matsanishe.
Oh, okay. Right. So the cardiovascular system will distribute the nutrients, the, the oxygen, the salts, and the water to various compartments. You can see on the diagram, you can see we have some water going into the urinary system, and the urinary system is going to use that, even the nutrients going there. You can see in the cell as interstitial fluid outside the cell. So the fluid which is outside the cell, but it's not in the blood vessel, it's called interstitial fluid. Okay. So because we are in the internal environment, we have the internal environment, which is the human body, the external environment, which is outside the human being. Okay, so of course, oxygen and carbon dioxide, they don't enter or exit through the digestive system. They enter or exit through the respiratory system, and they also go into the cardiovascular system for exchange. As we are only interested in the water because we want to understand what's going on with regards to how the water is being distributed. This is very important to us because it will help us to understand how a human being functions in a normal way. So this is where we start from. Unless someone has a question before we move to the next slide. Right, so you can see that water is going in, water is coming out. So we have water going in and coming out through the urinary system. And we can see sodium entering, even potassium entering through the GI system. And also it's supposed to leave the urinary system. Okay, even food does the same thing. Okay, so how is this water distributed in the body? Very important. How are the what is the composition of the electrolytes and also other components of blood, for example? We have to know that. Okay. Okay, so on this slide you can see the amount of water that one needs per day. You can see that the input for a normal person is supposed to be 1.5 liters, okay, which is 1,500 mils. Then for food is supposed to be 750 mils. Then for what is being metabolized is 250 mils. Okay, so what is being metabolized is just 10%. Okay. So from whatever you're going to take, 10% to be metabolized. Then the other diagram, you can see the average output per day. So the body will actually get rid of the 1.5 mils per day. That is what you're going to, that's the amount of water that will go out. Then we also have the amount of food that will go out, that is about 700 mils, and that is per day, actually. Then for things like sweat and also feces, we have 200 mils for sweat. We have 100 mils for feces, which represent 4%, and 8% for sweat. We also have insensible losses via the skin and the lungs, which amounts to 28%. For urine, 60%. So what goes in will come out. So the 1.5 liters is what is recommended for a normal human being. Okay. Okay, so on the left side of the slide, you can see what we are talking about. The the routes in which the various components are being lost. Okay, so you can see from the lungs, from the skin, sweat, feces, and also urine. Okay, so we can move to the next thing. Okay, so now what are some of the factors that affects the total body water? So we have already talked about this. The total body water is 70% of the body in most cases. Now, this slide is very important. You may think that this slide is not important because you already know the percentage, it's 70%. No. Now, this is where physiology becomes tricky. So we have got factors that may affect the total body water, okay? And these, they vary depending on the body fat. If you have noticed, most women are fat, okay? They are fat, and that will actually affect their weight because the weight of a person depends on the total body water. So as you can see, and that's why I put in infant. For an infant, the total body water is 73 to 80%. You have to memorize the percentages. No one is going to give you percentages in exams, in tests. You have to memorize on your own. So you can get the average of 73 to 80%. That would be somewhere like 75 or 77. That's for an infant. Okay, you need to get the average. For an infant has more total body water than any other category. Okay, any other group of patients. So for the infants, it's 73 to 80%. They have more water than anyone else. Okay. In case you're wondering what an infant is there anyone who knows what an infant is? Who an infant is? Hello? Anyone who knows what an infant is?
We know, sir.
Yes, tell us, Kyle. You know, tell us. Who is an infant?
A baby.
A baby. Everyone.
Yes.
So a baby, someone is called an infant when they're a baby. A baby is how old? From what to what?
Isn't it an individual
A
below the
baby
age
is
of
just
5?
a baby. Even big people, they are called babies in
Sir, an
which
individual
one?
below the age of 5.
An infant is
An individual below the age of 5.
an individual below the age of 5. So many states define an infant in so many ways. What do we call a baby who is 0 to 28 days? What do we call a baby who is 0 days up to 28 days? We call them what?
Embryo.
A baby, sir.
An embryo. Someone who is 10 days old at an embryo, a new baby. The anatomy people will laugh at you in embryology. Yes, what do we call a baby who is 0 to 28 days?
A newborn.
Everyone is a newborn. What of those babies for in the inboxes? Where do we put them? Okay, so a baby who is
I think
a
a future.
baby who is 0 to 28 days, uh, we don't call them a new. Yeah, of course, they are a newborn, but anyone can be a newborn. Even me, I'm a newborn. Like during your birth, they are a newborn. Okay, so the person who is from 0 to 28 days is a neonate. Anyone who is 0 to 28 days, it's a neonate. Okay? We are telling you that a baby, neonates inclusive, they have the total body water is quite large. Okay, it's big. You can see 73% to 80%. An infant, it's a general term which describes a baby from zero days all the way to about 3 years. Okay, we also have toddlers. Okay, we also have toddlers, but that's not our discussion. We are not doing pediatrics and child health. So an infant is anyone who is below 3 years old. Okay, so as you can see, the total body water for an infant is the largest there. For a male person, so that's why males, their weight is more than the weight of a girl. Okay, girls, they weigh less. You find the most girls here, they are 40 kgs. Okay, 50 kgs. Okay, most of the girls. Find a girl with 60 kg. That one is obese. Okay, so a male person, a male adult, not just any other male, a male adult like you guys, your total body water is 60%. So in physiology, it's not like you put things fixed. No, 70%. No, here we're telling you the exact thing, and that exact numbers must be memorized here. The male person is 60% because you won't be able to calculate. Okay, there's a question in the exam which is actually asking students to do some calculations, and if you forget what an infant, the percentage of an infant is, you are gone. Okay, they ask you about an infant, you bring the percentage for a male person, wrong. Okay, and this question actually, it's the weight, the percentage of for that applied question, it's not even here on the slides. It's missing actually. Forgot to put it. When uploading the notes, I'll put it. They ask about a pregnant woman, guys. Now, for a pregnant woman, the woman is separate, it's alone, it's a female, okay? A female adult. That is 40 to 50%. Now, a woman is carrying a baby in the womb. The baby will be put on the infant, the percentage of an infant. Okay, you put the baby on the percentage of an infant because it includes the 0 days. So if you are calculating, remember the percentages, we have 73 to 80% for the baby. For the male person, 60%. For the female, we have, and that is an adult, not just a female adult. Most of the people who are here are actually adults. A few are peds, okay? A few are children. So 40% to 50% of the people who are here, no. For the girls, they have that amount of total body water, okay? So even obesity will affect the total body water. Old age can also affect the total body water. You can see that it reduces as you age. The amount of water in your body reduces as you age. So even the climate level of physical activity can also affect the total body water. So fat is very important because males, they don't have so much fat. That's the reason why the total body water is so huge, okay, as compared to the females. Females, they have more fat and the water has nowhere to sit. Okay, can move on. If you have a question you should ask, just raise up your hand and ask. Loveness, you can unmute yourself.
So, sir, if they ask you the percentage of the infant, saying what's the percentage of water in an infant, do we have to like add 73 plus 8 and then divide by 2? The answer that we're going to find, that will be the answer that we put, or maybe we just get any number in the range of 73 to 80.
No, not any number. Not any number, guys. So what is going to happen right now is if you go in Guyton has a percentage which must be used by students. It's the same one which is in the slides. It's 73 to 8. You're supposed to find the average of that. Okay, the average person for an average normal person, normal infant. Okay, that would be the percentage that you are going to use, because very soon you see the calculations popping up right now. Okay, in a few minutes you will see calculations coming. You have to know how to calculate things. Okay.
Excuse me, sir. In terms of figures, since we have, is it for recommended books? So is it that they just give the same figures, or maybe you have to follow a certain book that you have to follow for the figures? Since you said you have to get the exact figures.
Yes, so again, I talked about this when I was introducing this course in the group in the know my courses. I said that if you're going to write an essay in PGY, stick to one book. Like, you know in your brain that these notes I'm about to write on the paper, they're coming from Guyton, or these notes are coming from Essentials. Please don't mix up data, because the numbers, they differ. It's not like it's wrong, no. Just the books, the authors, they differ, and use the latest information. So follow one book. You should quote it. You should say, let's say I mark you wrong. You should come back and say, but why did you mark me wrong? Because this information, I got it from Guyton. You see? So always use information which is just from one book. Avoid mixing up data. Okay. Yes, Chance, I can unmute yourself.
Okay, yes, sir. I didn't get about the TBW of a pregnant woman. What did you say?
For a pregnant woman, it's a complex question. So what is going to happen is that actually it's in the assignment. So the assignment is the same thing for a pregnant woman. You're going to do the calculation for the baby alone, and then you also do the calculation for the pregnant, for a female adult alone. Then you add them. That's what is going to give you something. You'll see as we are going to move on in terms of our progression. So you add for the infant, for the baby, and you get the percentage for the infant. Then for the female, you get for an adult, because in the books, no one has written about a pregnant person. So it only makes sense that you do separate calculations for the infant and also for the female adult. Don't get for the male adult. Males, they don't get pregnant, guys. Any other questions? Okay, so as you can see, the baby is carrying so much on this diagram. A man, like, it's not so much, as you can see. For the female, it's quite less as compared to the man. Okay, so that is what you need to know. That's the percentage of the water in the tissues. Okay, just a rough estimation. Okay, so what can you see on the corner of the slides? I'm wondering why that is not coming. Oh, it has already. What can you see on the corner of the slide? You can see someone with a kamathini. That's an old woman. So for an old person, you can see 45%. So it reduces. Okay. For a female, the percentage that you are getting, 50%. For an adult male, 60%. For a newborn infant, 80%. Okay.
So I've got a question.
Yes, please go on.
So when it comes to old people, there's nothing like an old female or an old male. It's just to get one percentage for both
Yes, it's
genders.
just get 1%.
All right, thank you.
Any other questions? Okay. So this slide is very important because there's actually an essay asking students to outline the body fluid compartments and how you measure the volumes. So this you can see that we have the extracellular fluid compartment and the intracellular fluid compartment. But what are these? Intracellular fluid compartment, it's inside the cell, it's the cytoplasm. That's why in brackets I've written cytosol. Okay? So intracellular fluid is just inside the cell itself. Whatever is outside the cell is called extracellular fluid compartment. Okay? Now, the extracellular fluid compartment is subdivided into 3 other compartments. That includes the plasma, which is found in the blood vessel, the interstitial fluid. Now, interstitial fluid is in between the blood vessels and the cell itself. So that fluid which is found in between the plasma and the interstitial fluid and the intracellular fluid is called interstitial fluid or interstitial space. Then what of the transcellular fluid? What is this? Because some books, you'll find that this transcellular fluid is not in other books. That's why it's very important to first read the slides, then go to the books, because in the book you find that something is missing. So as you can see, the transcellular fluid is going to include most of the small compartments, like the in the brain, inside the brain, we call that fluid as the CSF. Okay, CSF. Okay, so the CSF is found where? In the central nervous system. Then we also have intraocular. So intraocular just means in the eyeball. That fluid which is in the eyeball, okay, is part of the intraocular fluid. Okay. Then we also have the pleural fluid, which is the fluid in between the space between the lungs and the chest cavity. So there's a space there. It's called the pleural space. And the fluid that is found there is called pleural fluid. Then the fourth one is the peritoneal space. This one is a space between the intestines and the abdominal wall cavity. So that space there is called the peritoneal cavity, and the fluid that is found there is called the peritoneal fluid. The last one is the synovial fluid. The synovial fluid is a fluid that is found in the joints. You learned about synovial joints in grade 12. So obviously you remember what the synovial fluid was doing. So the synovial fluid is part of the transcellular fluid. So I'm going to repeat. The CSF, the intraocular, the pleural fluid, the peritoneal fluid, and the synovial fluid, they all fall under the transcellular fluid. Okay, so this is a very important thing. Now, what is going to happen now is that the intracellular fluid has got its own percentage, okay? The extracellular fluid has its own percentage and the intracellular fluid has its own percentage, okay? So the percentage of the intracellular fluid is 40%, okay? 40%. And then the extracellular fluid is what? 60%. Okay, so of the total body water. So the total body water starts at 100. Okay, in terms of when we demarcate the intracellular from the extracellular. So from the 100%, we have the intracellular, which is 40%. We have the extracellular fluid, which is 60%. Okay, then that extracellular fluid has to be further divided. You will see the percentages as we move on. Okay, so, and don't forget about that percentage of the total body water, like for an infant. So if you want to know what would be the volume of the intracellular fluid, there are some calculations and also some methods that are used. That's why you need to learn. Okay. Any question on this slide before we move to the next slide? Any question? Okay. So now, this needs serious gunning, guys. This slide here needs serious gunning. You need to remember everything on this slide. Everything. Okay? So, an average 70%, 70 kg person who are 42 liters. Okay? So, the total body water for a person who is 70 kg, it's 42 liters. Okay? Now, that 70 kg, that one, it's for an average person. So people have got different weights, okay, depending on the amount of water they have. So that 42 liters is for a person who is 70 kg, which means for a person who is not 70 kg, it's not 42 liters, it's something else. Okay, how then do you get to calculate the liters? Okay, you calculate the liters from the percentages of the water. Okay, the percentages of the water. For example, we can take this as an example. A person who is 70 kg, there are 40 liters. Okay, where is this 40 liters coming from? Anyone who can tell us where this 40 liters is coming from? Any good Samaritan to tell us where this 42 liters is coming from? Anyone? Elisa, are you in class? Hello?
Yes, sir.
Yes, tell us where the 42 liters is coming from.
You add the 28 and the 14.
No, 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 no. No. Yes, Tamika.
I'm just guessing, but you get 60% over 100 and then you multiply by the 70 kilograms, which will give you 42 liters.
Yes. So that's what you do exactly. So in the question will give you the weight of that person. Okay. And this is somehow funny. So for a pregnant person, they'll give you the weight for the pregnant person, not the weight for the female or the weight for the baby. No, it's for a pregnant person. So you should know what to do with the manipulations. So the total body weight it will be 60% in terms of the 42 liters. So the 60%, remember that 60% is for a man, okay? Somehow it seems like in medicine they are biased. They always start with a man, then they go to a woman. You see even in the dissections, they'll start with a male. So Zuckerman will start with a male, then they'll start talking about females later on. So even here is that situation. That 60% is for a male person. Okay, most of the male people, they are 70 kg. That's for a normal person. You have to be 70 kg. Okay, so 42 liters is found by doing 60% of the 70 kg. Give you 42 liters. Now, how you get to find the 28 liters? It's because of the percentage. You have to gun the percentage again. Out of that 60, 40% is intracellular fluid. Okay? Actually, intracellular fluid is much more bigger than the extracellular fluid. So, out of the 60, 40% is what? Is intracellular, meaning inside the cell, the cytosol, where the biochemical reactions are happening. So, there's more water inside the cells than outside. That 20%, again, this percentage were actually, they did some calculations or they found them using experiments, okay, which we're going to see later on. I'm sure it will be on Sunday because already it's 2 hours. We don't go over 2 hours. Whatever you're teaching, whether you didn't finish teaching, it's not supposed to go over 2 hours. The extracellular fluid is 20%, which is the fluid outside the cells, whether in blood or interstitial fluid or transcellular fluid. It's 20%. So the percentage is actually, oh, sorry. So that 14 liters, when you add it with 28, it will give you 42. You're not supposed to memorize the liters. Just memorize the percentages, that's all, because you'll be able to come up with the liters. So percentage of the total body weight and also the various compartments is very important especially when you're giving fluid therapy. For example, when you're giving someone who has got diarrhea, especially children, the ORS, you have to consider the percentages. Okay. So the 3/4 interstitial fluid and the 1/4 for plasma is part of the extracellular fluid. So extracellular fluid, that 20%, out of that 20%, 3/4 is what? Interstitial fluid. 1/4 is plasma, meaning in blood. Okay. So the interstitial fluid is 15% of the extracellular fluid. Then the plasma water is 5% of the extracellular fluid. A normal person has 5 liters of blood. So in the blood, you can actually calculate what percentage of water is there. Okay. Right. So this diagram on the corner, the right down corner, it is showing us the distribution of the body water. You can see in the cells, intracellular fluid. Okay, you can see outside the cell is extracellular fluid, and there are so many compartments in the extracellular fluid. You can see there is plasma water, there is interstitial fluid. Okay, and in the interstitial fluid, it is further divided into, it is part of the transcellular fluid, and which is divided into those CSF, synovial fluid, pleural fluid, peritoneal fluid, and so on and so forth. Okay. Right, so this is exactly 2 hours. I'm going to allow people to ask questions. We're not going to continue from here. We need to stop. because the next class is on Sunday, according to the timetable. Any questions? People don't want to ask questions.
Good evening, sir.
Good evening once more.
I have a question. Why is the extracellular fluid 20% instead of 60%?
Come again.
Why is the extracellular fluid 20% instead of 60%? As you mentioned on the previous slide, it's supposed to be 60%.
No, as in, so this is how it is. We said 70% of the body is water, okay? So already that 70 is like 30% is already out, okay? That is what we saw in biochemistry, but now we have different percentages in terms of, as it changes in terms of with regards to the fat. So we have a fixed percentage, which is 60. This 60 is for a normal person, the average of a normal person, and this is supposed to be a male adult. Now, from that 60%, the 60% of the total body water, 60% is the total body weight, okay? So 60% of the total body weight is water. Now, from that 60%, the one that appears to be bigger than the other is actually the intracellular fluid. Cells, inside the cells, the cytosol. So I swapped them. I was supposed to say 60% is intracellular, then the 40% is extracellular. But that is with regards to the 60, because we're not talking about 100%. You can't say the whole body is just water. It doesn't make sense. So that's how you see the percentages reducing to 40 and 20. Okay, I hope you get the sense out of that.
Yes, sir. Thank you very much.
Yes. Any other questions? Any other questions? Okay, so I presume people don't have questions anymore.
Yeah,
So you
excuse
can
me,
even
sir.
stop recording. Yes.
Yeah, excuse me. Oh, the percentage you said you swapped them. So the 40% is for ECF, right?
Come again.
So you said you swapped the percentage. So the 40% is supposed to be for ECF, then the 20 ICF.
You're skipping. I can't get some words that you
I was talking about the percentages. So you said you swapped them. So you mean the 40% is supposed to be the ECF, then the 20 ICF.
Anyone who got what she said?
Hello.
Yes, please.
So she's saying, since you're saying you swapped them, is it that the ECF is 40 and the ICF is 20? Is it? Yeah.
Yes, yes. So intracellular fluid is bigger than the extracellular fluid.
So if that's the case, if you're saying intracellular fluid is bigger than the extracellular fluid, that means that this slide is okay, but you just made a mistake when mentioning earlier on when you're telling us about the percentages that intracellular fluid has and extracellular, because you mentioned to say extracellular has got 60%. of which you made a mistake. So it's supposed to be extracellular has got 40% and intercellular has got 60%. And then when it comes on this slide, the extracellular is just okay because it's supposed to be less than the intracellular, which is 20 and 40. Huh?
Yes, what you are seeing on the slide is correct. I swapped them when I first talked about their percentages. I hope that
Doc,
is clear.
Doc, can
Yes,
you
please.
kind of explain on these percentages? Because on the previous slide you said that intracellular is 60, then extra it's 40, but now the figures have changed. It's 40 against 20.
Oh, the
So
figures. Oh,
yeah,
I see. Okay. Okay. So when I said 60% and 40, that was with regards to 100%. So if it's 100%, it's supposed to be 60 and 40. But if it's 60%, definitely the percentages will have to drop. So they are going to be proportion to the same 60 and the same 40. Okay, it's the same thing, but because this is 60%. We know that the total body water for an average person is 60%, not 100%. Okay.
that means that if I've got an average person with 60% of TBW, that means we're going to have 40% ICF and 20% ECF always.
Yes, always. Always. These ones, they don't change. They don't change with whether the person is a girl or a boy. They don't change. These ones are fixed. What is changing is the total body weight and the total body water. Is what changes. These ones, don't change them, please. Don't come back here and say no. I'm confused because how come the fat is changing things in a neonate or in an infant? This is the percentage. So what am I going to do with the intracellular fluid and the extra? These ones, they don't change. It's 20% and 40. Okay. So if you're going to do 40% of 60%, what you're going to get is something like 66%. We can drop it down to 60%, and the other one you find 30%. We can say 40%. This is what I meant. From that 60%, when we make it as 100. So forget about that. What you need to know is that we have 60% for an average person, then 40% is intracellular fluid, then 20% is extracellular fluid.
Sir, but of course we know to say the
But
60% is for a male adult. So what if they bring in a female?
yes.
We know to say female is in the range of 40 to 50, and let's make it to say the average is 50. So does that mean that the extracellular fluid has to be somewhere 15, then the intracellular, that would be 40, no, 15, yeah, 35?
She's skipping on my end. I don't know if there's someone who got her clearly.
Like what she was saying is that if the body weight changes, for example, that of a woman, which is, let's take the average to be 50, she was saying with the ICF drop to 35 and the ECF drop to 15, something like that. Or maybe this would always be
No.
constant, 40, 20.
Yes, this is a situation which confuses students. So these percentages you are seeing, the one for 40 and for 20, they are not changing. These are fixed. Whatever is there on the total body weight, it doesn't matter. But these ones will still remain 40 and 20.
All right, thanks, Doc.
Yes, don't change them. Otherwise, you are going to black out in the exam.
So what do you mean is when, for instance, let's say they put average weight of 85, so that means for ICF to be just 40, we use 40%, and the ECF 20, just like that.
Come again. I don't know why some people are skipping on my end. Come again.
All right, I was saying, can you get me?
Yes, I can get you now.
Yeah, so let's take for instance, they use the average total body weight as, let's say, maybe they use 80 or 85, then meaning on the ICF it will be just 40 and ECF 20.
Anyone who managed to got what you were saying is skipping on my end.
What he's saying is that if the body weight increases maybe to 85, the ICF and the ECF, they are not going to change. Bro Emmanuel, they are not going to change. They're just going to be constant.
Let's say we meet a man who is 100 kg. We meet a man who is 100 kg. Those percentages for intracellular and extra, they are not going to change. They will still remain 40, and 40 and 20. So this is what is happening here. The percentage of the percentage is following the category of the person you're dealing with. If you are dealing with a man, if they mention a man, just know for a man, what's the average weight for a man? It's 60 kg. And the total body water, what's the percentage? It's 60 again. Okay, so in that 100 kg, whatever is happening in that 100 kg, 60% of that 100 kg is water. Okay, and in that 60, we have 20 extracellular fluid, we have 40 intracellular fluid. Let's change this question. Let's say an infant, they mention an infant is 3 kg or 5 kg. To find the total body water, you need to memorize that percentage. It's 70, it's actually 80%. 73 to 80, find the average. That percentage, do percentage, then multiply by the kgs for the baby. That's 5 kg. That will give you something. So that something, it's actually the volume of the water that you have. Okay, that volume of the water that you have has to be distributed equally into 20 and 40. I hope that is clear. These numbers are fixed. These ones for intracellular and extracellular are fixed. Nothing is changing.
So, but for the water, does it change, or maybe even it's just fixed as well?
You mean the total body water?
Yeah.
Okay, so for the total body water, it changes with weight. Okay, it increases as the weight is also increasing. So when you find the total body water at first, then you distribute it into 20 and 40. So these ones don't change. The total body water changes. I hope I've answered your question. These ones don't change. Don't change them.
Right.
And don't be confused.
All right. I
Yes,
think you
this is
give us
very
an
confusing
example
stuff.
that will make us understand very well.
Yes. I'll do that definitely. So on Sunday, I'm going to give you an example. You're going to see. So questions are not going to be direct. They're not going to ask about this 60 kg peso, the 70 kg peso. No. They are going to ask, they're going to ask, they're going to ask about something complicated, like for a pregnant woman. So that question for a pregnant woman, it was actually hard. Even some lecturers couldn't solve that question. Okay, you'll see it as we go on with the classes. Okay, any other questions? Okay, so I'm sure people are not asking questions because they are obviously understood or they are scared. Which one is which? Scared or understood?
I know we've understood. On my part, I've understood.
Okay. Okay, so if you don't understand a thing, please someone is asking. Oh, okay, there's okay. The practice question is actually it's hard. Let me get it. You'll see it. You'll see it. It's hard for a pregnant woman. You'll see it. I'll post it. Okay, so guys, thank you very much. We continue PGY on Sunday according to the timetable.